Hello, I'm Sarah Russell, former producer of the ADHD Skills Lab. I'm thrilled to introduce my latest project, the Neurodivergent Report, an educational podcast dedicated to empowering neurodivergent individuals with accessible scientific knowledge and amplifying their exuberant stories. In each episode, we'll explore topics like the genetics and heritability of neurodiversity, alongside practical strategies for managing executive dysfunction and emotional dysregulation. Together, we can learn to heal in community. However you are able to engage, thank you for being here. Hello, I'm Sarah Russell, a host of the Neurodivergent Report. I'm joined here today with my other host, JQ.
Hello.
And our guest, Dr. Jessica McCarthy. Jessica is a licensed clinical psychologist and founder of Elements Psychological Services. She's also a divorced mom of two, a certified school psychologist, and a late diagnosed ADHDer who brings clarity, compassion, and humor to big, complex topics like autism and ADHD. So much to talk about today. Thank you for being here.
Thanks for having me.
I don't even know where to start. I mean, I didn't even mention that you've been on podcasts before. That's fine. I feel like that will be self-evident. You have so much experience and education. So I think I'm just going to go out of left field and say, did you want to be a psychologist when you were little?
No. No.
Tell me about it.
I thought that, well, I mean, as we were saying before, I grew up like in an Irish, Italian, Catholic household in northern New Jersey. Your problems, your stressors, your dramas were kept within the four walls of your home, and it just like we just didn't talk about certain things. And I had begged to go to therapy just because I'm like, I just needed to talk to someone like outside of my family. When I was in high school, I was like on and off, and I loved it. But I had just assumed that I would be like working on Wall Street, married with two kids by the time I was 25. I don't know how I arrived at that number. It seems a little young, but
in hindsight,
that was the journey. And by 25, I'd finished my first master's. I was working up at Columbia Presbyterian. I had just dumped my college boyfriend, and I moved back home. I was like, well, this didn't work out as planned. And actually, when I was in college, I started taking like business and like foreign policy, like all the like right classes for that. And then I was failing them because I didn't like them.
Oh.
So, but I always loved my psychology classes. I love the study of human behavior. So, and I always did well in my psych classes, with the exception of intro to psych. I did have to take that twice as well, because it turns out you have to go to class in order to pass. So it was really my first semester of college is that when I was like, oh, there's something else going on here. It wasn't even until beyond that I was diagnosed, but the lack of executive function skills became apparent then. So I just was kind of like, this is where I need to be. This is what I love. This is what feels comfortable. So as corny as it sounds, it kind of found me.
Yeah, you realized that if you followed that intrinsic motivation, then you could be successful in an academic environment.
Yes, I fought it tooth and nail though, because of this, like, oh, you're a psychologist, but I love it. It's where I'm meant to be.
I know. I tried to take like economy classes, like economics, and it was just like counterintuitive to all of the sociology stuff that I was taking, and so I just like couldn't stop.
We're all set here. We tried.
But the research is super strong that different life stages, the transition from high school to college can be really stark for people with ADHD who don't know it, especially even if you do know it sometimes. And then even like the supports out there aren't, at least they weren't 10, 15 years ago, available. We didn't know what to do. Just like, write it down. Just show up.
I think developmentally, that late teens to early 20s transition, that or what I call like emerging adulthood, I think it is developmentally one of the most difficult times. And the patients that I've been working with from from high school through college, they see it. They're like, oh yeah, and graduating college too. Like, yeah, now we understand it.
Yeah, and I think that that even extends to like the fact that it's like, oh, okay, you're 18 now, so you have to decide what you have to do for the rest of your life, and that's what you're doing for the rest of your
Which
life.
I think is also a problem, but we have
Just
a
a
lot of work
bit
to do, I
skills
think.
training here.
Yes,
For
we
sure.
have a lot of work to do with both parents and the kids as far as educating and fostering independence. But I also think that that starts when children are younger. If a
Yeah.
parent is over involved at this stage, chances are they were when the child was younger as well. So those are things that we work on educating both when we're doing assessments and we're doing therapy, with children and especially the family, especially the parents, to be thinking about things like let's work backwards here. Like, what is your end game? What are the goals you're actually trying to work towards? Bigger picture, what are the skills that you want your child or young adult to have to prepare them for adulthood, whatever their adulthood looks like? Because again, not everyone's going to college, not everyone's going to work. Everyone's goals and everyone's kind of path in life is going to be different due to a number of factors. So let's kind of figure it out, be flexible as necessary, and start, again, good combination of supports and teaching so children, young adults can thrive and really maximize quality of life.
Couldn't have said it better myself. I love that. I'm just going to move on because we're going to circle back to assessments in the next section. Okay. So you are open about your own late ADHD diagnosis. I want to ask you both about your diagnostic journey. Like, was it hard for you? Was it easy? How did you know? But I also want to ask about whether or not you've faced any stigma from your peers in the mental health field. So attack those questions however you see fit.
Sure. So I wasn't diagnosed. I never was formal. I never had an assessment because by the time it was brought to my attention that this might be was going on, I was in grad school for my doctorate. I knew all the tests. I knew the DSM criteria. So I could never have a formal evaluation. And I was in therapy. It was my first year of my doctorate. I was having, like, my anxiety was through the roof. I presented with anxiety. So it was always like, you have anxiety, you have GAD, you have OCPD, obsessive compulsive personality disorder. Everything's got to be, a right way. No, I was just hyper fixating on certain things. And I think one of the reasons I did so well in grad school is because body doubling is a strategy that I love. And as a single parent now, I kind of miss that. Like, I don't body double with my 10 and my 7-year-olds. I like having other adults around. So I always studied and worked in groups with friends. So like it didn't even occur to me that not only that was a strategy of just a difference in terms of how my brain was wired. But when my therapist at the time said to me, "Has it ever occurred to you might have ADHD?" I was like, "Oh no! Oh my God, no, it's not me." Like the stigma that even I still held as a practitioner, because you think of ADHD, it's like, oh, that's a behavioral kid. That's a kid that's bouncing off the walls. Like, that's a kid that can't listen. Like, no, that's not me. Like, I was rule governed. Like, baby, tell me what to do. Like, I'm here to please. I am the people pleaser. Like, I'm here to make dreams come true. And then I thought back to my childhood, and my room was always messy. My locker was always messy. My notebook was always messy. I always turned in assignments either right at the last minute or they might have been a little late. I procrastinated, but like I was in the gifted and talented program, so I always got stuff done. There was no reason for me to do it differently outside of my parents breathing down my neck, like, you can't wait till the last minute. Yes, I can, because it's working. And until, and I did well enough. Like, I was in AP classes in high school, like science. I didn't like the classes that required a little bit more structure with studying and hindsight. Like, I started to slip a little bit, but I was just like, oh, I'm just not good in those areas. I didn't like them anyway. No big deal. But then my first semester at Lehigh, I ended with a 1.67, and not because I was in the wrong classes or not because I was partying too hard, although I definitely was using alcohol to kind of cope, but I didn't know how to study. I didn't know how to time manage. I didn't know how to navigate the volume of material because waiting till literally the night before to study didn't cut it anymore. So then I just stopped going to class. I'm like, I'll figure it out before the midterms or the finals. And then that didn't happen. I really struggled with writing reports because there were a lot of components to reports. So I started therapy again. And that's when someone said to me, I think you might have ADHD. And lo and behold, she was correct. As far as stigma in the field, I mean, I am still struggling with wrapping my head around my diagnosis, kind of merging what I know about the research with my own personal experience, because it was something that never even occurred to me. And I had just talked with my mom about this a couple of months ago because I hadn't even shared it with my parents because there was shame, there was guilt, there was like sadness for like what we didn't know back then. And my mom was like, "Oh, I'm not surprised. I knew." And I'm like, well, "Why the fuck didn't we do anything about it?" But
Yeah.
you know, we didn't know it back then. We didn't look for it. And I masked tremendously, and my grades were always stellar. So I was not the kid that was flagged, but I was suffering tremendously. And I still get, sometimes some of my colleagues would be like, "You don't have ADHD. Like, it's just anxiety." And then I question myself, like, well, are they right? Am I wrong? Like, am I a fraud? Like, do I even want to talk about some of these things? Do I even know enough to talk about some of these things? I don't want to be one of those people on social media that is like saying all the incorrect stuff about ADHD. So I'm not going to say nothing. I'm like, "Jessica, this is the anxiety. Let's pause and work on yourself in terms of kind of understanding and embracing and appreciating who you are and having a lot of compassion for yourself, in that space. And you have nothing to
Yeah.
prove to anyone. Like, this is not me versus anyone. This is me versus me, you versus you."
Yeah, I think there's like a lot there. Even just you feeling like, am I a fraud? Like, and like not trusting yourself. Not only is that something that I think a lot of people who get diagnosed with ADHD or autism go through, because like also recently it's like, oh, everybody wants that. Everyone wants to get diagnosed with that. Like, where you're like, okay, am I being one of those people? But also like from a young age, because your brain works differently, you've probably been like, there's that statistic of like, I think kids with ADHD get corrected like
Yeah, 8 to
10,000
10 times.
times.
Yeah, something like that.
Yeah. Yeah, like, and so it makes sense that you don't always trust your brain. Similarly, with like the whole with like the gifted and talented, it's called, so like 2E, like twice exceptional for people listening, is when there's two exceptional things happening, and exceptional meaning it doesn't happen all the time. So one being neurodivergent and two being gifted in school. That 2E experience of like, I know that I'm not doing really the right things all the time, but like it's working fine, and not getting the supports you need, not building the skills you need until you're off on your own. And then you're in a completely new space. You now are having a completely new like dynamic of classes. And it's just like way too much to handle. And then
Create your own structure for the first time ever.
right. And also not knowing that you have ADHD is another layer on that, because you're like, oh my God, what is wrong with me? Like I had so much promise, like what's going on? Like what's wrong with me? And if you just knew how your brain worked and what your brain needed, it would have been hopefully better. But yeah.
Yeah, my college experience was really interesting because so the first semester was terrible. I pretty much failed everything because, yeah, you have to go.
You have to go to class. Wild concept, right? Like,
Yeah, but then I would get like straight A's the next semester, but then I would burn out from like overperforming. And so I would need like to recover another semester. And so I would do poorly again. And so that's sort of a young adult manifestation of that spiky profile that we see in autistic and ADHD young kids. And so I figure that's a perfect segue.
Yeah.
I'm gonna again keep talking about myself. So I have two children. I have an 11-year-old who is diagnosed with ADHD, and I have a 2.5-year-old who has a significant speech delay, but no like formal autism diagnosis, although his dad is on the spectrum. We're going through that whole process, so it's really cool that you're here in front of me. Yeah, he's got a super spiky profile. My son doesn't really speak to communicate, but he can count to like 10. He knows his ABCs. He knows his shapes and his colors. Yeah, he can do communication sometimes. He might come up and like throw a ball at you and say, "Oh, purple ball,"
I mean, it's even interesting how you're saying like he communicates sometimes, because I'm like, well, he is communicating with you. It's just not in the neurotypical way
Exactly.
that we are that neurotypical folk define communication as, which I think is, I think one of the biggest stigmas that those of us the autism and ADHD world are working on educating, families, even families with children who are autistic. It's just there are different ways of communicating, and that's okay. But also as parents too, like working on it being okay, because maybe this wasn't how we thought that this whole parenting experience was gonna go. So being able to hold space for helping your child, but also for what you're moving through at that time, the joys, the sorrows, the celebrations, the grieving. It's a lot.
Yeah, I really love the 5 stages of grief for thinking about like anything identity reconstruction-y. Getting
I learned from my life: denial, anger, bargaining, depression, make acceptance, Deb.
Anger
Yeah.
and acceptance.
Yeah.
Yeah.
Denial, anger, bargaining, depression. Yeah.
Depression,
See?
acceptance.
Comes back. Don't ask me anything else though from my boards. I'm gonna have to Google that real quick.
Hey, that's okay. That's okay. That's a sort of like a niche reference, but it's good for because so the person who designed it for people who were dying, grieving that experience, and so that's sort of another version of reconstructing your identity in a way. So yeah. Anyway, hold on. I need to go back to our notes. What are we talking about? We're talking about assessments. Yeah, gosh, I don't even know what I want to ask. There's so much.
I mean, I can start. I did. I mean, why don't we just
Um,
get into assessments? Because I think
yeah, I don't
have
even know
like some
I don't
thoughts
even know
about.
what to expect. And so I don't even know what to like worry about. Like what would be a red flag? I don't even know.
But when you say red flag, what do you mean by that?
So if I were to hear the clinician say something, that might be a red flag that, oh, they are ableist or something. Just like
Okay.
if someone were to tell me that for example, my own pediatrician said that my son can't possibly be autistic because he responds to his own name and he points to what he wants.
Yeah.
Sure. So I feel like it's like
I
ableism and not being like up to date, I guess, with like current understandings of like the current literature, I guess.
Yeah.
Yeah.
I'll even say this too. I think the research, especially in the diagnosis and assessment and understanding of ADHD and autism, is growing so incredibly fast to the point where when I was in grad school and I was in my doctorate and I finished in 2014, the idea of autism, like autism wasn't something we learned. We focus on anxiety and depression, like all the traditional clinical psych stuff. And then like autism was brought in, but it's like, ooh, like you're only autistic if you're like really severe and you're nonverbal. Like that was even in grad school, like the idea of what we were trained as. And we were
And
also
that's so
trained.
crazy to me because those are all just the people who are comorbid something else.
And it was like, ooh, like you can't do autism unless like you specialize in it. Like a colleague of mine, she did her intern. She was the only person in our class. Like she did her internship. She has a like solely focused on autism practice right now. But it was like, ooh, if I thought anything like was in the wheelhouse of autism, I got to refer out. I can't do that. I'm not good enough. I'm not trained enough. But the reality of it is that the more we've learned about it, and then there was an emphasis on ADHD. So it's like, all right, what are we doing for ADHD assessments? You put 10 psychologists in a room, you're going to get probably 3 or 4 different ideas about what we need to do to diagnose, how much testing, how much is too much, because there's people out there who, not wrong, say like all you need is a really, really good clinical interview and maybe a couple of self-reports and you can diagnose this. And yes, but it also, context is important. Is it a child or, someone in school or even an adult who's working? Do they need a 504? Do they need an IEP? Do they need both? Do we need to flesh out what's going on diagnostically? And do we need to understand what's going on academically so we can make the appropriate conversation or recommendation? That battery is going to look a little bit different from another battery that we might do if it was just like, I need a yes-no diagnosis. But here's the thing is that, again, what we're also learning is that ADHD is comorbid with so many things. Autism, dyslexia. I can't tell you how many times in our practice we see kids come in, and like I said, it's for this particular thing, it's mostly kids, like middle school, maybe high school, early high school, but mostly late elementary, early middle school, where like their grades are okay. The parents like, my kid has ADHD. And, we start asking like, how are they doing with reading? How are their grades? Their grades are fine. They're dyslexic as well because they've either, their IQ is high enough that they figured out ways around it to compensate, or they just throw extra time. The assignments take twice as long, and the kids are getting by enough, but like they're melting down at home. There's anxiety, there's depression, there's like, no, but your kid's got a freaking reading disorder as well. And it's not the parents' fault because these aren't the
It's
cases
so hard to pick
that
up
are
on these
going.
internalizing things.
And these
Yeah.
aren't the cases that like people think of, oh, my kid's dyslexic. They mix up their B's and their D's and their 3s and their 5s, or twos and 5s, whatever.
No, it's
It
like,
looks
oh,
different.
I forget my left and my right.
Yes.
Like, oh, I need to count on my fingers still, and I'm
You can
35
have a
years
reading
old.
disorder.
Yeah.
Yes, like you can have a reading disorder that's not dyslexia. You can have
Yeah.
dyscalculia. You can have method. Like there's so many things to look at. Those batteries look different as well. But it got to the point in our practice, when we started, it's like, oh, we do ADHD evals. And my one colleague and I said, I was trained on the ADOS and internship. I hate the ADOS for a number of reasons. That's like a whole other podcast. But I said, we need to get everyone brought up to speed on autism assessment. Let's do the MIGDAS. Let's do our trainings. Let's get our supervision. Let's do our due diligence here, because we cannot be doing a good job of just assessing for ADHD if we're not ruling out autism, and vice versa. So we're all trained on the MIGDAS. We've taken countless presentations in assessment and diagnosis. In even the medical model of me is coming back, I'll say atypical presentations of autism in women. I know. I am
awareness though, because we just recorded a podcast about the medical model and the neurodiversity model. I love this.
And that's not a knock to my professional colleagues. Maybe it is a little bit, because I don't, like I said before, I don't understand, like if you're keeping up with the literature, or even if you're just on social media in the ADHD and autism space, it's in your face, the level of comorbidity. And actually, to give a diagnosis of autism, you need to rule everything else out first. I mean, that's just kind of typical nomenclature in the DSM. Like you need to rule out things. But I can't tell you how many times we have had parents call us and they've had evaluations done before, whether it's done by the school, whether it's done by, an outside professional. They have a diagnosis of ADHD. Maybe they've got something else too, a little anxiety, a little whatnot. And they're like, something is missing. And most of the time it's the autism piece. And because it wasn't looked at, because there are still clinicians out there who think of autism in a very stereotypical way.
Yeah.
And, I always joke, like I was trained in grad school on the medical model. I think I was like one of the last cohorts before we really switched to thinking about assessment, from the neuroaffirming, neurodiverse way. But I always struggle because in writing reports, and like I said, I've worked in a number of settings. I've worked in schools, I've worked in hospitals, I've done TBI and stroke, I've done psycho, I've done it all. And nothing sucks more than being like, this skill is impaired, low average, borderline of what? Like, yeah. I never understood on the belt, borderline of what? What the hell is that describing? Because when people see that in reports, they're like, oh yeah, I have borderline personality. No, it's just a shitty descriptor that we're using that doesn't really tell us much aside from what the kid and the parent already knows, is that they're not doing well in an area. And wow, I just kicked you while you're down.
Yeah.
And intrinsically, I've always, because I'm a decent human being, forget about clinician, like I've always asked, like, what do you like? Like, what are you good at? Like, let me get to know you. And that's kind of like the mantra of our practice. Like, we're here to tell your story, the full story. I want to know what you do well. I want to know what your strengths are, because like, if I can help incorporate that into recommendations, then like I'm making everyone's life easier. Like, I don't want to work harder than I have to. Like, showing up with ADHD and trying to get through stuff is hard enough. Like, why am I trying to make this more difficult on myself? So as we've really transitioned towards embracing a more neuroaffirming model as clinicians, like I said, sometimes like we still slip in terms of thinking about it medically because insurance companies want that. The LSAT, the BAR, the GMAT, when we write for those settings, they're like, we want to see how bad this person can do. And we get asked, so like, don't write this necessarily in a neuroaffirming way. Like, I want you to like write the worst report possible so they can get an accommodation. It's like, I get it. Like, I want to meet people halfway. I don't want to make it difficult for someone, but it's a lot. And I think it's also a really exciting time because it's such a huge opportunity for us as clinicians to work with our fellow providers in PT, OT, speech in the schools, pediatricians, developmental pediatricians, because we're educating them too. Because as neuropsychologists and clinical psychologists, we spend the most time with you diagnostically, period.
Yeah.
So let us do our job. Let us help you. Let us get to know you. Let us do the thorough assessments. So yes, we can identify the areas that need more strengthening. We can actually clarify what the diagnosis is. So again, my office manager, first thing people say to her is, I don't know what's going on. Great. That's literally our job as psychologists, is to help you figure that out. And then let's tailor the recommendations to talk about the strengths, talk about the things that you're interested in. So whether it's going to be used in IEP, 504, parenting plan at home, work, we're making this easier. So I think of the neuroaffirming approach not just as the easy way out, but as because it's not like we're literally helping people maximize their
doing
quality
more
of life.
work up front, but yeah, so that they can have a better outcome in the long run. I think I love hearing all of this, and I'm trying to tease apart what's different about this compared to experiences that I have had personally. I don't know if it was like 6 months ago or a year ago, it doesn't really matter. We were going through the initial assessment for my son. We ended up stopping because we were too all over the place. We were in like the 6-year-old section and then also the 1-year-old section. And basically, she asked me about hand flapping. And I was like, no, he doesn't do hand flapping, but he does other sorts of stimming. And she was like, yeah, we don't care about that.
Okay, wait, was this like who? Was this like I don't know, who knows? Like
No, it was a BCBA who was doing the assessment. And so they are trained to do the assessments on children who are under 3 years old. However, due to the amount of misinformation and just I
don't know if we're going to be releasing the video on this, but just the disappointment on Jessica's face is priceless.
please release the video. I mean, I
Yeah.
can't. This is like
release the tapes.
Yes.
Show the receipts. First of all, I'm sorry you had that experience.
I'm so glad it was me though, because I have the knowledge to know how bullshit that was. And I'll be able to stand up for my son. And so I want to educate other parents
why you're
who are
doing
going
what
to
you
be
do,
out
yeah.
there 100%. And that's why that question was so important to me, because that would be a sign. That would be a red flag. Like, hey, maybe you might need to get an assessment somewhere else, actually. What you're doing is so special and it's not the standard. And
And also, like, even if someone is still cultivating their skill set in this area or around neuro-affirming practices, don't be an S. Like, I think that's like a very, like this isn't even like autism specific. This is rapport building. This is relationship building. This is, I get more flies with honey than I do with vinegar. That's incredibly invalidating. And I mean, I would either probably lose my shit or shut down. Like, I can't imagine that would go well if someone spoke like that to me. So good for you for not doing that, because I probably would not have been able to do that in that moment. But, F around and find out, I guess.
honestly, I'm always terrified that if I act out in public in the wrong way, then some authority figure is going to make a case to take my kids away from me.
You know what? Like, I actually don't disagree with you on that. And as I was sitting here, I was like, Jessica, would you really say that? I probably would say something, being like, well, let's actually think about this. Like, I probably would have handled it professionally, but internally, I would not have wanted to. So,
100%. Yeah, and your face might not even match the tapes either.
My face probably would have been like,
it's so hard.
I'd like to think I probably would have kept, maybe my bark would have been worse than my bite. But see, I'm also like, where in New Jersey where we're at, I'm spoiled because we have like
yes, you are.
We are. My professional network of colleagues is top notch.
Who do not live in a healthcare desert.
Yeah. Oh, no, I've never even heard that phrase, but yeah, I believe it.
Okay, so in Connecticut, we have this program called Birth to 3, where if at any stage before 3 you have concerns about your child's development, you can call and get access to SLP, a speech language.
New Jersey has early intervention as well. Yes.
An occupational therapist, the BCBA, and then a couple of other professionals, but the parents don't always know to trigger it. The professionals themselves don't always know what help they can provide. Personally, trying to schedule with like 3 different providers and also still have a job is driving me crazy, actually.
Yeah. New Jersey actually has an excellent early intervention program, but sometimes there's a wait, or sometimes parents aren't happy because if the provider is not necessarily as well versed in what the child or the family thinks needs to be addressed, so the parents end up going private. I mean, there's also the cost component too, because we all know that if there is an area of development that seems to be developing at a different pace and not meeting milestones, we need to get the earlier the better. But if there's a wait list, that's not going to fly. If there's even a few weeks wait list for an 18-month-old, that's a huge chunk of time developmentally. I'm very lucky with my professional network and how we work together. I'm not interested in taking parents' money indiscriminately. I'd rather wait a little bit till the child's older, because then there's just more assessment tools at my disposal that I can use. And I hate the adage of like, a pediatrician, like, they're going to grow out of it. We're not growing out of this. But with that
They're going to grow into something else.
You're going to grow into something else. But also, if I can get you set up with the right service to target this specific issue, then I can get a greater sense of like what the trajectory is looking like. I'll have more data points before you're coming in for my assessment. And at that point, we're talking about IEPs and 504s, even at like the pre-K or the kindergarten level. So there's just more information that we can get by the time somebody comes to our practice, because we're going to put them with the right subspecialty to get that tailored service or services. So then I'm spoiled. I'll get the PT report. I'll get the OT report. I'll get the SLP report. Like, my work is done. And then I just, I'll do my part, the quick and dirty part. And I can tie it all together in like such a beautiful way that, when you see the gratitude on the parents' faces, like, we did the right thing. Like, and it's not just me taking someone's business. It's literally sending you out to go see someone who's going to do what your child actually needs, and then come back to me, and we can tie it all together. It's fun.
Yes, because the mental health issues are not really just in the brain. They have such cascading effects everywhere, and that's why we need to attack like all of the different specialties. Yeah. But then we need someone to be able to bring all of the results together and like say like, okay, we're actually managing this person all right. Well, hey, maybe we need to like get this person this other kind of support. And obviously the parents aren't all supposed to do that.
No, because we don't get a parenting playbook at birth. You're certainly not getting one now. And like, my biggest concern is like, I just want, there have been times like we've sent the kids out to get speech or whatnot, and like we'll still do work with the parent because like they're having like a come to Jesus and wrapping their head around like what is going on. So we're able to work with the parent, we're able to provide support. And for the youngest kids, I mean, even toddlers up through late elementary, early middle school, like the research is clear, like the work being done with children at that age, the majority of it's with parents, not only to make sure there's carryover to the home environment, but parents need help managing their own stuff too, and learning how to parent in a different way than they might have been raised if it was a neurotypical household, especially. Or for some parents, it's like, oh, by the way, you have ADHD or autism too. We see that a lot. Like, my kid's got this. Oh, I do too.
Yeah, like I do this, so it's like completely normal.
They're just like me.
Yeah.
Oh, here's my kid. I love that.
I have a whole
kid.
family
Why don't you come in here, my guy?
Yeah.
My sister. Let's talk about this because, well, let's get a 2-for-1 here while we're at it.
Yeah.
No.
I guess on this, can we transition maybe to some common signs that someone might be autistic and have ADHD, and potentially that they're maybe only diagnosed with one? I know that's kind of two loaded questions, but yeah.
So there's overlap in a few areas, and broadly, you're looking at kind of attention and focus issues, although they will look a little bit different in ADHD and autism. ADHD, you're struggling to maintain attention. There's distractibility, or even again, like more accepting. You need extra supports in those areas, extra guidance and whatnot. With autism, the attention. This is like the medical model. So what you do when it's writing, like, but what we're seeing presenting with attention is it's very intense. It's very focused around specific interests, which also can make shifting, switching to another activity or transitioning difficult, which then leads to the next one in terms of we're talking about executive function issues. And there is a good overlap that we'll see with both, especially in younger kids, like difficulties with reasoning, planning, organizing, prioritizing tasks, managing time. Emotion regulation also falls into executive.
I was going to say meltdowns,
function.
but
The meltdowns. It's just a function of why the meltdown is occurring. And in what way? Also, the social interaction piece. So, ADHDers and autistics. Also, I also have a hard time with the word autistics. Like, again, that's just a medical model of me. Like, I just had to say that. That was my ADHD
Tangent.
Writing it feels one thing. Saying it out loud, it's I don't know. You can cut that or keep it. It's totally cool.
It's a hard line to walk where it's like I'm trying to express an idea how I can and how I think that most people can understand me the best, but sometimes the wording that is common might not be the best. So it's a hard line to walk.
Yeah.
It's interesting. I mean, a side note, and then I'll get back to what I was saying. I actually ask patients, I'm like, where do you fall on this?
Yeah.
Because from an identity standpoint, sometimes patients refer to themselves as an AD or an autistic. Like, sometimes people don't. Like, I actually don't like calling myself an ADHDer. And again, maybe it's because I'm still like working on that. But like, for me, it's a piece of the pie. It's not how I frame my identity. Similar with being like a divorced parent. Like, I'm not divorced. Like, I'm a parent who happens to not be married. Like, I don't encapsulate my identity about a relationship that didn't work. So,
Yeah.
but again, like the medical model is drilled into my head, but sidebar to that.
Yeah.
Getting back to the similarities of ADHD and autism, difficulties with social interactions. For us ADHD folk, a lot of it just could be impulsivity, not being able to read the room, being blunt or blurting things out. For me, especially, it's like I feel like if I don't tell every single detail of every single thing, then I'm doing a disservice to someone.
They don't have all the
I'm,
context. Like they
yeah,
don't know.
I'm not reading the room. Whereas, autistics they have difficulties with social interactions as well, but it's understanding the nonverbal piece. It's understanding social cues, understanding the emotional, and because of the way that an autistic brain is wired, it takes extra time to sort through all of that incoming verbal and nonverbal information, and then be able to react or respond appropriately. Oh, and then we'll throw masking onto that because you
Oh
know
yeah.
I might not understand instinctively how to engage in a social situation, but cognitively I learned it. So I just need to make sure I kind of plug in the certain things into my equation of social interaction and get it out. Damn, that's exhausting, right?
Leads to
And then
burnout.
burnout, yeah. And then we also see, sensory sensitivities with both ADHD and autism as well. So
Something that I kind of wanted to say before, and I feel like we're kind of touching on it, and I feel like it's a good opportunity for me to be like, ooh, the thing that I wanted to say. So we're kind of not touching on like these other layers of ADHD and autism that people don't always think of. And it kind of gets me back to when you were talking before about like labels and labeling. I don't feel weird anymore. And this is, I feel like, been like in the last few months. Well, for the last few years with ADHD, but the last few months with like autism, because I feel like I've not only do I have a much better standing of like what those two things actually are and how they present in different populations, but on top of it, it's like the word like ADHD, attention deficit hyperactivity disorder, is that label was given by somebody who's probably didn't have ADHD. And the label is based on how an ADHDer's person affects them. They see it's like a deficit in attention. And it's
from a
not about
neurotypical lens, yes.
exactly. And it's not really touching on like the main things that they could struggle with. And similar with like autism, the word autism comes from like self-absorption because people would think like, okay, yeah, these people are just like in their heads, they don't want to be social. And it's like it's just not effectively grasping really about what that experience is. So personally, I don't really feel weird about using those labels because it's just the easiest way to communicate to somebody like this is to what your understanding of it is, this is something that this is how my brain works. And for the people that it actually matters with, I can have a conversation with them and actually be like, okay, so this is really what's going on. And this is the difference between maybe what you think might be going on based on your preconceptions of these words. So that was
Sort
my
of like, ooh,
side
this is
tangent.
a really intimate, it's sort of
Love
like, ooh,
that.
this is a really intimate part of my life.
Yeah.
And this person actually has been through it. And so they might understand.
Yeah. Like it's like they have a better chance of like, because there'd be a lot to explain and break
Or they
down.
won't judge me for this,
Exactly.
maybe, yeah.
It's like basic, it's
Right.
worth it to have that conversation, if that makes sense. You can't have
Yeah,
everybody.
1,000%. And I
Yeah.
think that's important. Like sometimes I get a little, you know, with the swing in the neurodiversity movement and people almost like becoming upset and offended if you're not using neuro affirming language. And I'm like, okay, I get it, 1,000% on board. Because if you're stigmatizing or hurting someone, then you're doing the wrong thing. But I'm like, isn't the point to have like what is the point here? Let's work backwards here. Is it to actually have the conversations and make sure that we are inclusive of everything? Because isn't the whole point of neurodiversity it is inclusivity? And maybe I'm a little bitter, to be honest, that like I wasn't diagnosed until a little bit later. Like
Yeah.
I always felt different. I always like stuck out. And for me, like my emotion dysregulation with my ADHD and with anxiety was anger outbursts. And I would get like very snippy and snotty. And I'll never forget. I had a teacher say to me once, hurts my feelings. Even like talked about this now.
Yeah.
She was like, she's like, do you know what the word snot means? And I was like, okay, people pleaser. And I'm like, well, yeah, it's a brat. And she's like, well, yeah. She's like, maybe you should look that up in the dictionary. And this was a teacher that I really, really liked. I think about that on a weekly basis. And like, I cried for such a long time. This was in
God.
middle school. And I realize now it was because Like it was, I mean, part of it was the anxiety and personality and temperament of like people pleasing and like wanting to do good and wanting to get praise, because I learned from a very young age, if my grades are good, people will love me. And maybe they won't love me for my quirks or the way that my brain was wired, because I sure as hell got shit for it. And to some extent, I still do. But like the parts of me that I didn't like and then I still struggle with the anger, with the emotion dysregulation, I'm like, wow, I just wasn't understood. And it was just different, and different was bad, and there wasn't room for inclusivity of like what children do and why they do it. So yeah,
Yeah.
maybe I have a hard time with neuroaffirming the language, because I didn't get to, I mean, also old habits die hard, but like I didn't get to experience that sense of feeling understood. I was just labeled as different, but I was lucky, and I will go all in on this privilege, because I never was IQ tested, but I always, or if I was, I don't know, but I always did. I was in like the 99th percentile on all my standardized tests, and I was smart, and I was a good athlete, and I was a good dancer. So I was able to skate by and get away with, like, because I was good in other areas that were considered popular. So a lot of like my quirks and
Had lots of
intricacies, like they
stimulation.
were ignored because I was so good in these areas, but I struggled tremendously.
I very much relate to that. I think we were talking about it like a few podcasts ago, but like I have a like I it's gotten a lot better, but I used to have a lot of like stake in like my ability to perform and do well. But I did dance as well, same thing. And also just like being a conventionally attractive person, and then that very much leading into like I had eating disorder for a while, and those things were very much like hand in hand.
Uh-huh.
And also, I feel like you should give yourself more credit, because the difference between the story that you gave with your teacher and you using neuroaffirming language is that like you are so clearly approaching things with like curiosity and wanting to understand. So I think that most people, and I mean, there are people who can be sensitive about these things, and I totally get that. But I think most people, if they just talk with you and they just literally talk with you for a few minutes, they would know that like it's not the same thing.
No, I
Yeah.
appreciate that. Look, I try to just treat people how I want to be treated and how I wasn't treated, and how I was kind of misunderstood. Like that's
Yeah.
kind of the guiding principles for our practice, for how I do things, and even how I navigate parenting my own children, who have their own
Same.
spiciness in their own
Yeah.
different ways, especially as a single parent. Like it's only me. So if
Yeah.
I'm having a bad day, if I'm dysregulated, like I got to get my shit together and fast, or not. Or sometimes I take a break and I go cry in a bedroom, my bedroom or the bathroom. But yeah, I don't, as a single parent, I don't have the luxury to necessarily tag out, but I always try to come from a place of understanding, because when I can model slowing down and understanding and kindness and consideration, both in my practice and at home, the outcomes are better when connection is the priority as opposed to like a specific outcome. And that's still hard. That's hard, because every parent, I think, wants their kid to succeed and just do well and do good and be something in the world, whatever the hell that means, whatever the fuck that looks like. But like just want my children to feel understood in ways that I wasn't. Again, that's not a knock to my parents, it's not a knock to teachers, because in the 80s and the 90s, we did things differently and we didn't know. We weren't educated. So the fact that I can even have a conversation with my mom about like ADHD is huge.
Yeah.
Huge.
Yeah.
Give her credit. Deb.
Yay, Deb.
Yeah,
Let's go, Deb.
She listens to everything.
Thank you,
Just listen.
Deb.
I'll have to pull up the podcast. She follows everything on social media, and she'd be like,
Aw,
"Why were you doing this?" She'd be like, "What shirt were you wearing? I didn't know you had that shirt." I'm like, Deb,
I love that.
we love Deb.
I was just loving on your sapphire shirt.
Thinking the same thing. I was like, I don't know when I'm going to compliment her, but she needs to know. I love the shirt.
Thank you, ladies. It's Amazon. It's
Wow.
Amazon. I
Get
will
the
send you
plug
the
in
link
there.
if you remind me. I will send you the link. I love, like I'm going to be 43. Like I don't know much, but I know the basics like of what works for me. I don't try to do anything fancy. I keep it simple. But yes, Amazon jewel tones tend to be my jam.
We love.
I just want to know, like, so what are you knitting over there? Like, I'm jealous. I'm like, I want to do something right now.
So
Yeah.
I'm trying to
I am
focus because I'm the guest here. I got to keep it together. What are you working on over there?
I'm making hearts so that I can give them away
love
for
that.
charity.
I know.
I love that.
Very cute.
Yes, I
That
love
way
that.
people get to carry some love with them and reminder of whatever they need it to be. I've been an ADHD coach for the last 4 years, and I find that, we need reminders, but nobody wants to just keep cluttering their phone with reminders. And so this is a really nice like totem, you can sort of put it
Tangible. Oof.
wherever.
Yeah.
Exactly. And so every time I see these, I've just been taking some deep breaths. And it's great to slow down these days. I have to force myself to, because otherwise I
All over the
don't.
place. Just stick to tattoos. I have a tattoo on my hand that says, well, actually, I have a shamrock on my ankle that I got right when I turned 18. It didn't go over well. Deb and Dennis, they didn't like that. They didn't talk to me for a week.
Oh my God.
No, it really didn't go well. Like that was like I was a straight, like I didn't drink, I didn't do drugs, I didn't do anything. But this, I have pants on, I can't show you. Like a
It rocks their world.
square inch tattoo of a 4-leaf clover. Like I even said to them, like, I don't do cocaine. Like if this is the worst thing that's gonna happen.
I'm doing pretty good.
Like we're good.
Yeah.
And then I have a twin brother, and then he got, and it started the domino effect.
So honestly, I'm so glad that we got to see you.
Me
And
too.
but I feel like you didn't spend enough time telling people how they can get involved with your services. So how can we find you online? How can we pay you?
How can we pay you? I love that, because we are a business, but we're a fair business. I always say that. Our offices are located in New Jersey. Our main office, our first office, is in Montvale, New Jersey. It's right on the New York border in Bergen County. And in hopefully mid-May 2025, we're going to be opening in Morris County, which is about 45 minutes south and more north central in Chatham, New Jersey. You can find us there. Myself and one of the other doctors, the other Jessica in the practice, Dr. Jessica Bajoli, we have what's called Psych. So we have a teletherapy license that we can treat people in over 40 states across the country. We do not do assessments virtually. There are some tools that we can give certain. So if I'm doing therapy with someone, I'm trained to do assessment. I will always give a measure. I give a self-report, just so I can get a different flavor, a different perspective. Like, have your husband fill this out, have your wife, have your parent fill this out real quick, like just something like quick and dirty. But we can see people for therapy and also executive function skills training, which is kind of what is my hybrid of the executive function coaching piece, but also the emotion regulation piece.
I feel like there's so much we didn't talk about that maybe we should have you on again to do like a research heavy episode.
We can do some research.
No, this is what we do. We meet
Yeah.
up, we get tattoos and some shirts together. Then little coffee afterwards, talk about a
the booth.
research outline.
Perfect.
Yeah.
Perfect. That sounds good.
Let's do socials. Where can we find you on social media?
Yes. So the name of our practice is Element Psychological Services. I think the website is www.elementpsych.com, but just Google it. And
That'll be in the show
it'll be in the show
notes.
notes. The practice Instagram is elements_psych. My professional Instagram handle is dr.jessica.mccarthy. So if you find one, you'll find the other.
I'm going to make sure,
because they're linked together.
yeah, I'm going to make sure that we're following you.
Yeah, I'm literally like on and off social media, like post my shit, and then I go
I'm
do
the
something
same way.
else. Go to something else.
Yeah,
Otherwise,
it's a
I'll
lot.
go down
It's
the rabbit hole
overwhelming.
and I won't get anything done. So this was so much fun. Thank you.
It was so great to meet
Super
you.
agree.
I needed this
Yeah,
today.
It was really nice to meet you. Thank you for being here. If you want to connect with the Neurodivergent Report, you can find us at ND Report Pod on Instagram, Threads, TikTok, and YouTube. If you're looking to support the show, the best thing you can do is to subscribe and leave a 5-star review on your podcast platform of choice. Please. You can check out ndreportpod.com for more information, or if you want to be a guest contributor. Until next time, be well, do good.